Tracheal T-tubes and tracheostomy tubes are medical devices used in the trachea for various medical conditions. While there are some similarities between the two, there are also some major differences. Knowing which tube to use is essential when trying to manage your medical needs. Join me this week as I discuss tracheal T-tubes and tracheostomy tubes. A tracheostomy tube is a medical device which acts as an artificial airway. It is inserted directly into the trachea through a surgically created hole called a stoma. It is often made from silicone, polyvinyl, or metal. Breathing is done mostly through the tracheostomy tube and bypasses the upper airway. When breathing in, air travels through the tracheostomy tube and down to the lungs. When breathing out, air travels from the lungs up the respiratory tract and out the tracheostomy tube. The reasons for needing a tracheostomy tube can be many, but the four general reasons include: the patient will require mechanical ventilation for more than 1 or 2 weeks. The patient is unable to protect his airway. The patient cannot manage his own secretions and requires frequent tracheal suctioning. The patient's upper airway prevents adequate ventilation due to cancer, trauma, deformities, or other medical conditions. Before receiving a tracheostomy tube, a hole in the trachea called a stoma needs to be made. To create a stoma, a surgeon or doctor will sedate the patient and an incision will be made into the patient's neck. Once the hole is made, a tracheostomy tube is inserted. Once the stoma has healed, which usually takes about 2 weeks, the tracheostomy tube can be removed, exchanged, and reinserted by the patient, medical professional, or caregiver. If the tracheostomy tube is accidentally pulled out, a tracheostomy tube can be reinserted by the patient, caregiver, or medical professional. A tracheostomy tube provides an artificial airway which bypasses a person's upper airway. A tracheostomy tube can be connected to a ventilator. A tracheostomy tube can be cuffed, which will allow for a person to receive full respiratory support from a ventilator. A tracheostomy tube can be removed and reinserted without the need to undergo a procedure. A tracheostomy tube can have an inner cannula. If the tracheostomy tube becomes clogged with mucus, the inner cannula can be removed to clear the tracheostomy tube of the mucus plug. A tracheostomy tube can be suctioned. If changing the inner cannula and suctioning do not get rid of the mucus plug, the tracheostomy tube can be removed, the plug can be cleared, and the tracheostomy tube can be reinserted. If the tracheostomy tube needs to be changed to a different size tracheostomy tube can be inserted without the need of undergoing a procedure. The tracheostomy tube requires the use of tracheostomy tube ties or a tracheostomy tube holder to keep the tracheostomy tube in place. The end of the tracheostomy tube must be covered when showering. The tracheostomy tube is larger and more noticeable than a tracheal T-tube. Since breathing is done via the tracheostomy tube, the cold, dry room air can dehydrate the airway and cause mucus plugging. The airway must be kept moist by using various methods such as a heat and moisture exchanger, a cool mist trach collar, a heated humidifier, or a nebulizer. Using a tracheostomy tube may make speaking more difficult. A tracheal T-tube is an artificial stent made of silicone. It is shaped like the letter T. The tracheal T-tube is open at both ends. It has a limb which extends from the tube through the tracheal wall and out through the skin. A tracheal T-tube maintains an airway in the trachea while providing support to the trachea. The tracheal T-tube is intended to be used with a cap over the outside limb. Breathing is done through the upper and lower limb of the tracheal T-tube. When breathing in, air travels from the nose and mouth down the respiratory tract through the upper and lower limb of the tracheal T-tube and down to the lungs. When breathing out, air travels from the lungs up through the lower and upper limb of the tracheal T-tube and out the nose and mouth. Uncapping the outside limb is usually only done to suction the tracheal T-tube. Tracheal T-tubes are often utilized in patients with stenosis of the airway. This is a condition in which the airway is narrow. These conditions include tracheal stenosis, subglottal stenosis, and laryngotracheal stenosis. Also, tracheal T-tubes are mostly used shortly after a person's trachea has undergone surgery for tracheal reconstruction. The tracheal T-tube helps prevent the airway from collapsing while the trachea heals. Tracheal T-tubes may also be used when there's trauma to the larynx or trachea. And lastly, a tracheal T-tube may rarely be used as a substitution for a tracheostomy tube in select individuals. A tracheal T-tube is usually inserted surgically. A hole is created in the trachea. The tracheal T-tube is bent and inserted with a forceps into the trachea. If the tracheal T-tube needs to be changed out, the patient will have to undergo another procedure to place a new tracheal T-tube. If the tracheal T-tube is accidentally pulled out, a tracheostomy tube should be inserted into the hole in the neck, and the patient will have to undergo a procedure to reinsert a tracheal T-tube. Please note, once a tracheal T-tube has been removed from the airway, it cannot be reinserted by the patient or caregiver. The tracheal T-tube does not require the use of tracheal ties to keep the tube in place. The tracheal T-tube provides support to the airway. With the cap placed over the outside limb, showering can be done safely without the risk of water entering the airway. Since the tracheal T-tube is intended to be used with the cap placed over the external opening, there is a low risk of developing a mucus plug. If mucus plugs the tracheal T-tube can be uncapped and a suction catheter can be inserted into the tracheal T-tube. Tracheal T-tubes are not intended to be used with a ventilator. Tracheal T-tubes are open at both ends. This means if a person uses a ventilator, some of the air will be directed up the airway and out the nose and mouth. Tracheal T-tubes do not have cuffs on them. They cannot be inflated or deflated. Thus, tracheal T-tubes cannot be used in a person who needs full respiratory support from a ventilator. If a person needs an artificial airway to breathe, the tracheal T-tube is not intended to be used with the cap off the outside limb. Removing the cap from the outside limb will cause mucus to accumulate and possibly block the tracheal T-tube. The tracheal T-tube does not have an inner cannula. If the tracheal T-tube becomes clogged with mucus, suctioning will need to be performed. If suctioning cannot clear the mucus plug, the tracheal T-tube must be removed and a tracheostomy tube inserted until another tracheal T-tube can surgically be inserted. My friend Mark had a tracheostomy tube. His ear, nose, and throat doctor suggested he get a tracheal T-tube. Mark underwent the procedure to get a tracheal T-tube. It took about 3 hours total from the time he arrived at the hospital until the time he was dismissed. Within a month, he ended up having to go back to the hospital and have a second tracheal T-tube placed because the first tracheal T-tube did not fit well and caused a lot of pain. The second tracheal T-tube was also removed due to the pain it caused and not fitting properly. Mark has now changed back to using a tracheostomy tube. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!